Different types of counseling. Which counseling approach is described as counselor centered? Option: non directive counseling, eclectic counseling, directive counseling, supportive counseling. Answer of this question is option C, that is directive counseling. In which type of counseling does the counselor do the analysis, synthesis, diagnosis, prognosis, prescription, and follow up? Option of this question is child centered counseling, directive counseling, non directive counseling, family counseling. Answer of this question is option B, that is directive counseling. What is the primary focus of child centered counseling? Option: the counselor's expertise, the constructive side of parents and child, predetermined solution, strict behavioral modification. Answer of this question is option B, that is constructive side of parents and child. Which counseling technique integrates psychodynamic, cognitive behavioral, and interpersonal conceptual models? Option: eclectic counseling, directive counseling, supportive counseling, non-directive counseling. Answer of this question is option C, that is supportive counseling. Which of the following is not a typical focus of supportive counseling technique? Option: reducing client distress, addressing psychological causes directly, providing comfort, guiding the client. Answer of this question is option B, that is addressing psychological causes directly. Family counseling primarily focuses on option: individual psychopathology, relationship and interaction between family members, parental authority establishment, children's academic performance. Answer of this question is option B, that is relationship and interaction between family and members. Which counseling approach allows the counselor to switch between different techniques based on the situation? Option: directive counseling, non directive counseling, eclectic counseling, child centered counseling. Answer of this question is option C, that is eclectic counseling. In non directive counseling, the primary goal is option: solving the immediate problem, following the counselor's advice, independence and integration of the client, restructuring family dynamics. Answer of this question is option C, that is independence and integration of the client. Which counseling technique is also known as permissive counseling? Option: directive counseling, eclectic counseling, supportive counseling, non-directive counseling. Answer of this question is option D, that is non-directive counseling. In which counseling approach does the counselor play a more active role than the client during the interview? Option: non-directive counseling, eclectic counseling, directive counseling, child-centered counseling. Answer of this question is option C, that is directive counseling. What is the correct sequence of steps in directive counseling? Option: analysis, synthesis, diagnosis, prognosis, counseling, follow-up. Synthesis, analysis, prognosis, diagnosis, counseling, follow-up. Diagnosis, prognosis, analysis, synthesis, counseling, follow-up. Analysis, diagnosis, synthesis, prognosis, counseling, follow-up. Answer of this question is option A, that is analysis, synthesis, diagnosis, prognosis, and counseling and follow-up. Next, which step is directive counseling involves predicting the future development of the problem? Option: analysis, synthesis, diagnosis, prognosis. Answer of this question is option D, that is prognosis. In non-directive counseling, who plays the most active role? Option: the counselor, the client or pupil, the client's family members, a team of mental health professionals. Answer of this question is option B, that is the client or the pupil. What is the primary basis of effort in non-directive counseling? Option: the counselor's authority, mutual trust, acceptance, and understanding. The client's willingness to follow advice. The counselor's ability to diagnose quickly. Answer of this question is option B, that is mutual trust, acceptance, and understanding. In eclectic counseling, what is considered the key note? Option: rigidity, consistency, flexibility, authority. Answer of this question is option C, that is flexibility. Which counseling approach is characterized by its freedom to use any procedure or techniques that seem most appropriate? Option: directive counseling, non-directive counseling, supportive counseling, eclectic counseling. Answer of this question is option D, that is eclectic counseling. What does the synthesis step in directive counseling involve? Option: collecting data from various sources, organizing and summarizing the data, formulating conclusions about the nature of problem, predicting future developments. Answer of this question is option B, that is organizing and summarizing the data. Next, in supportive counseling, which of the following is not typically a focus of counselor? Option: reinforcing healthy pattern of thought, reducing intrapsychic conflicts, maintaining a neutral demeanor, encouraging adaptive behaviors. Answer of this question is option C, that is maintaining a neutral demeanor. What is the primary objective of counselor in supportive counseling? Option: to maintain a blank canvas for transference, to reinforce healthy and adaptive pattern, to focus solely on past traumas, to avoid emotional engagement with the client. Answer of this question is option B, that is the reinforcement healthy and adaptive patterns. Which counseling approach is most likely to use a metaphor of a seed growing into a healthy plant? Option: directive counseling, eclectic counseling, child centered counseling, supportive counseling. Answer of this question is option C, that is child centered counseling. In non directive counseling, how does the counselor typically respond to the client's feeling? Option: by challenging negative emotion, by redirecting it more positive topics, by accepting and recognizing both positive and negative feelings, by focusing only on positive emotions. Answer of this question is option C, that is by accepting and recognizing both positive and negative feelings. What is a key assumption in eclectic counseling? Option: one theoretical approach is available, always superior. Each theory may contain some truth. Techniques should never be mixed. The counselor should stick to a single approach throughout. Answer of this question is option B, that is each theory may contain some truth. In directive counseling, who typically makes the final decision? Option: the counselor, the client or pupil, the client's family, a mental health review board. Answer of this question is option B, that is the client or pupil. Which counseling approach is most likely to use techniques like active listening and giving advice in the early phases of therapy? Option: non-directive counseling, directive counseling, supportive counseling, eclectic counseling. Answer of this question is option C, that is supportive counseling. What is the primary role of counselor in non-directive counseling? Option: to provide solution to the client's problem, to direct the client's thinking through advice, to assist the client in analyzing and synthesizing their own problems, to diagnose and treat mental disorders. Answer of this question is option C, that is to assist the client in analyzing and synthesizing their own problems. Eclectic counseling: what justifies the rejection of any philosophical framework by the counselor. Option personal preference, having a better way to achieve the task at hand, client's request, institutional policy. Answer of this question is option B, that is having a better way to achieve the task at hand. Which counseling approach emphasizes that problems differ from individual to individual and each problem must be treated as unique? Option directive counseling, non directive counseling, eclectic counseling, supportive counseling. Answer of this question is option C, that is eclectic counseling. What is the primary focus of problem focused coping strategies in supportive counseling? Option situations that cannot be changed, emotional regulation, situation that can be changed, avoidance of problems. Answer of this question is option C, that is situation that can be changed. In child-centered counseling, what is the counselor's view of the parent's role? Option parents are seen as obstacle to therapy. Parents know their child best and are crucial to support. Parents should be excluded from the counseling process. Parents' influence is considered minimal. Answer of this question is option B, that is parents know their child best and are crucial to support. In eclectic counseling, what is the relationship between the client and philosophical framework? Option the client must adapt to the framework. The framework is rigid and unchanging. Both are adjusted to serve the purposes of the relationship. The philosophical framework is disregarded entirely. Answer of this question is option C, that is both are adjusted to serve the purposes of the relationship. What is a key characteristic of the counselor's approach in non-directive counseling? Option giving frequent advices, attempting to manipulate the client's decisions, trying to understand and follow what the client is saying and feeling, focusing on quick problem solving. Answer of this question is option C, that is trying to understand and follow what each client is saying and feeling. In supportive counseling, what type of relationship does the therapist aim to establish with the client? Option distance and professional, fully emotional and supportive, neutral and analytical, confrontational and challenging. Answer of this question is option B, that is fully emotional and supportive. Which counseling approach is most likely to focus on constructing clear, simple, and specific plans for behavioral changes? Option non directive counseling, eclectic counseling, supportive counseling, child centered counseling. Answer of this question is option C, that is supportive counseling. Next, what is a key competency required for effective eclectic counseling? Option strict adherence to a single theoretical framework, knowledge of all major theories and philosophies in counseling, avoidance of any directive techniques, focus on rapid problem solving. Answer of this question is option B, that is knowledge of all major theories and philosophies in counseling. In directive counseling, what is the primary role of the counselor during the interview? Option passive listener, equal participant, more active than the client, neutral observer. Answer of this question is option C, that is more active than the client. Which counseling approach is most likely to emphasize the counselor's warmth, friendliness, and understanding while also maintaining objectivity? Option directive counseling, non directive counseling, eclectic counseling, supportive counseling. Answer of this question is option C, that is eclectic counseling. In non directive counseling, how is the development of insight typically achieved? Option through the counselor expert analysis, through a gradual process following free expression, through immediate problem solving, through strict behavioral modifications. Answer of this question is option B, that is through a gradual process following free expression. What is a key feature of child-centered counseling approach? Option: focusing on child's weaknesses, emphasis on quick behavioral changes, focus on the constructive side of parents and child, reliance on medication for treatment. Answer of this question is option C, that is focus on the constructive side of parents and child. In supportive counseling, what is the primary goal of reinforcing healthy defense mechanism? Option: to increase client dependency, to reduce symptoms of mental disorders, to avoid addressing underlying issues, to promote regression in therapy. Answer of this question is option B, that is to reduce symptoms of mental disorders. Which counseling approach is most likely to allow the client to terminate the relationship without solving the specific problem brought to the counselor? Option: directive counseling, non-directive counseling, supportive counseling, eclectic counseling. Answer of this question is option B, that is non-directive counseling. What is a key characteristic of eclectic counseling regarding the use of techniques? Option: strict adherence to a single set of techniques, random application of various techniques, careful selection based on specific situation and client, avoidance of any established techniques. Answer of this question is option C, that is careful selection based on the specific situation and client. In directive counseling, what does the diagnosis step primarily involve? Option: collecting initial data, organizing client information, formulating conclusions about the nature and causes of problem, predicting future outcomes. Answer of this question is option C, that is formulating conclusion about the nature and causes of problems. Which counseling approach is most likely to emphasize the counselor ability to alternate between different techniques within the same session? Option: directive counseling, non-directive counseling, eclectic counseling, supportive counseling. Answer of this question is option C, that is eclectic counseling. In child-centered counseling, what metaphor is used to describe the child's potential for growth? Option: a machine needing repair, a blank slate to be written upon, a seed growing into a healthy plant, a puzzle to be solved. Answer of this question is option C, that is a seed growing into a healthy plant. Which type of counseling focuses on identifying and changing negative thought patterns? Option: psychodynamic counseling, cognitive behavioral therapy, person centered therapy, gestalt therapy. Answer of this question is option B, that is cognitive behavioral therapy. In which counseling approach does therapist act as a blank slate for the client to project their feeling into? Option: solution focused therapy, narrative therapy, psychoanalytic therapy, existential therapy. Answer of this question is option C, that is psychoanalytic therapy. Which type of counseling emphasizes the importance of present moment and self awareness? Option: behavioral therapy, rational emotive behavioral therapy, gestalt therapy, family system therapy. Answer of this question is option C, that is gestalt therapy. Which counseling approach focuses on helping clients identify their strengths and resources to solve problem? Option: solution focused brief therapy, psychodynamic therapy, Elderian therapy, existential therapy. Answer of this question is option A, that is solution focused brief therapy. In which type of counseling does the therapist use techniques such as empty chair, dialogue, and role playing. Option: cognitive behavioral therapy, person centered therapy, gestalt therapy, psychoanalytic therapy. Answer of this question is option C, that is gestalt therapy. Which counseling approach emphasizes the importance of birth order and social interest? Option: Jungian's Jungian's therapy, Elderian therapy, Rogerian therapy, existential therapy. Answer of this question is option B, that is Elderian therapy. Which type of counseling focuses on helping clients create new, more positive narratives about their lives? Option: cognitive behavioral therapy, narrative therapy, psychoanalytic therapy, behavioral therapy. Answer of this question is option B, that is narrative therapy. In which counseling approach does the therapist primarily use techniques such as unconditional positive regard and empathetic listening? Option: cognitive behavioral therapy, psychoanalytic therapy, person centered therapy, rational emotive behavior therapy. Answer of this question is option C, that is person centered therapy. Which type of counseling focuses on helping clients identify and challenge irrational beliefs? Option: cognitive behavioral therapy, person centered therapy, gestalt therapy, rational emotive behavioral therapy. Answer of this question is option D, that is rational emotive behavioral therapy. Which counseling approach emphasizes the role of unconscious processes and early childhood experiences? Option: behavioral therapy, cognitive therapy, psychodynamic therapy, humanistic therapy. Answer of this question is option C, that is psychodynamic therapy. In which type of counseling does the therapist help clients explore issues related to meaning, purpose, and existence? Option: cognitive behavioral therapy, existential therapy, family system therapy, solution focused belief therapy. Answer of this question is option B, that is existential therapy. Which counseling approach focuses on changing problematic behaviors through reinforcement and punishment? Option: psychoanalytic therapy, cognitive therapy, behavioral therapy, humanistic therapy. Answer of this question is option C, that is behavioral therapy. In which type of counseling does the therapist use techniques such as dream analysis and free association? Option: cognitive behavioral therapy, person centered therapy, gestalt therapy, psychoanalytic therapy. Answer of this question is option D, that is psychoanalytic therapy. Which counseling approach emphasizes the importance of the client therapist relationship and view the client as the expert on their own life? Option: cognitive behavioral therapy, person centered therapy, psychoanalytic therapy, rational emotive behavior therapy. Answer of this question is option B, that is person centered therapy. Which type of counseling focuses on helping clients identify and modify core beliefs about themselves, others, and the world? Option: cognitive therapy, behavioral therapy, psychodynamic therapy, humanistic therapy. Answer of this question is option A, that is cognitive therapy. In which counseling approach does the therapist help client explore their relationship with family members and how this relationship impact their current issues? Option: cognitive behavioral therapy, person-centered therapy, family system therapy, and solution-focused belief therapy. Answer of this question is option C, that is family system therapy. Which type of counseling emphasizes the integration of mind, body, and spirit in the healing process? Option: cognitive behavioral therapy, psychodynamic therapy, holistic counseling therapy, rational emotive behavior therapy. Answer of this question is option C, that is holistic counseling. In which counseling approach does the therapist believe help clients explore their cultural identity and its impact on their mental health. Option: multicultural counseling, existential therapy, gestalt therapy, behavioral therapy. Answer of this question is option A, that is multicultural counseling. Which type of counseling focuses on helping clients develop more adaptive ways of thinking and behaving in specific situations? Option: psychoanalytic therapy, person-centered therapy, cognitive behavioral therapy, existential therapy. Answer of this question is option C, that is cognitive behavioral therapy. In which counseling approach does the therapist help clients explore and resolve conflicts between different parts of their personality? Option: cognitive therapy, gestalt therapy, psychoanalytic therapy, internal family system therapy. Answer of this question is option D, that is internal family system therapy. Which counseling approach focuses on helping clients identify and fulfill their basic psychological needs? Option: cognitive behavioral therapy, reality therapy, psychoanalytic therapy, existential therapy. Answer of this question is option B, that is reality therapy. In which type of counseling does the therapist use art material as a means of expression and exploration? Option: play therapy, cognitive behavioral therapy, art therapy, narrative therapy. Answer of this question is option C, that is art therapy. Which counseling approach emphasizes the importance of understanding and working with the client's defense mechanism? Option: behavioral therapy, person centered therapy, psychodynamic therapy, solution focused belief therapy. Answer of this question is option C, that is psychodynamic therapy. Which counseling approach focuses on helping clients develop more effective communication and problem solving skill within their relationships? Option: individual therapy, group therapy, couples therapy, family therapy. Answer of this question is option C, that is couples therapy. In which type of counseling does the therapist use play and toys as primary tool for communication and expression? Option: art therapy, play therapy, cognitive behavioral therapy, narrative therapy. Answer of this question is option B, that is play therapy. Which counseling approach emphasizes the importance of understanding and working with transference and counter transference? Option: cognitive behavioral therapy, person centered therapy, psychoanalytic therapy, gestalt therapy. Answer of this question is option C, that is psychoanalytic theory therapy. In which type of counseling does therapist help clients explore and resolve trauma related symptoms? Option: cognitive behavioral therapy, trauma focused therapy, solution focused belief therapy, existential therapy. Answer of this question is option B, that is trauma focused therapy. Which counseling approach focuses on helping clients identify and change maladaptive scheme or core belief? Option: behavioral therapy, person centered therapy, schema therapy, narrative therapy. Answer of this question is option C, that is schema therapy. In which type of counseling does the therapist use mindfulness techniques to help clients manage stress and emotional regulation? Option: cognitive behavioral therapy, psychoanalytic therapy, mindfulness based stress reduction therapy, rational emotive behavioral therapy. Answer of this question is option C, that is mindfulness based stress reduction therapy. Which counseling approach emphasizes the importance of understanding and working with the client's attachment style? Option: cognitive behavioral therapy, attachment based therapy, Gestalt therapy, solution focused brief therapy. Answer of this question is option B, that is attachment based therapy. In which type of counseling does the therapist help clients explore and resolve issues related to their sexual health and relationship? Option: couple therapy, family therapy, sex therapy, group therapy. Answer of this question is option C, that is sex therapy. Which counseling approach focuses on helping clients develop more effective coping strategy for managing chronic pain? Option: cognitive behavioral therapy, psychoanalytic therapy, person-centered therapy, existential therapy. Answer of this question is option A, that is cognitive behavioral therapy. In which type of counseling does therapist use exposure techniques to help clients overcome anxiety and phobia? Option: psychodynamic therapy, person-centered therapy, exposure therapy, narrative therapy. Answer of this question is option C, that is exposure therapy. Which counseling approach emphasizes the importance of understanding and working with a client cultural background and values? Option: cognitive behavioral therapy, multicultural counseling, psychoanalytic therapy, gestalt therapy. Answer of this question is option B, that is multicultural counseling. In which type of counseling does the therapist help clients explore and resolve issues related to their career development and job satisfaction? Option: family therapy, career counseling, group therapy, existential therapy. Answer of this question is option B, that is career counseling. Which counseling approach focuses on helping clients develop more adaptive way of thinking and behaving in social situations? Option: psychodynamic therapy, person-centered therapy, social skill training, art therapy. Answer of this question is option C, that is social skill training. In which type of counseling does therapist hypotonic technique of helping client access unconscious resources and promote change? Option: cognitive behavioral therapy, hypotonic therapy, gestalt therapy, rational emotive behavioral therapy. Answer of this question is option B, that is hypotonic therapy. I think these are the questions which may not become, but you need to see. These are the questions mainly from different therapy of counseling. So, though we have only the types of counseling in our syllabus, so I don't think such kind of questions may arise in our question paper. After then, also, if you wish, then please have a look of all these questions, which can or which may be help you in your cognitive development as well as